Mothers Against Drunk Driving, or MADD, was founded over 30 years ago by a mother whose daughter was killed by a drunk driver. She wanted to bring awareness to the problem of drunk driving with the hope of preventing other families from ever having to experience the devastation that can result from drunk driving. Our name is Mothers Against Drunk Driving because it's an accurate representation of who we are. We're not against the drivers. It's the act of driving drunk that we hope to stop altogether one day. MADD focuses on three main objectives. First, the campaign to eliminate drunk driving has the goal of protecting our families from drunk driving and ultimately ending the threat of drunk driving on America's roads by supporting the heroes who keep our roads safe. High-visibility law enforcement officers catch drunk drivers and discourage others from driving drunk. Also, by requiring convicted drunk drivers to blow before they go. Ignition interlock devices, or in-car breathalyzers, require all convicted drunk drivers to prove they are sober before the car will start. And by turning cars into the cure. Tomorrow's cars will protect each of us, automatically determining whether or not the driver blood alcohol content is at or above the legal limit of a 0.08, and failing to operate if the driver is impaired. Second, MADD's goal is to protect our country's youth from the dangers of underage drinking. Today, 1 in 3 8th graders drinks alcohol, and teen alcohol use kills about 6,000 people each year, more than all illegal drugs combined. MADD has already seen success in this area. MADD has saved close to 30,000 young lives through the passage of groundbreaking public health laws. Understanding that parents are the #1 influence on kids' decisions about alcohol, MADD created the program Power of Parents, It's Your Influence, offering research-proven strategies to help parents keep their children safe from the dangers of underage drinking. This program, in combination with other efforts, will help reduce the number of underage drinkers. MADD also works to create a positive environment for the growth and development of our children by developing and implementing tactics that discourage adults from providing alcohol to underage drinkers. And MADD continues to support the 21 drinking age, a law that saved thousands of young lives. And last, as one of the largest victim services organizations in the United States, MADD also supports the victims and survivors of drunk and drug driving. We serve one person every 9 minutes at no charge. As long as drunk driving impacts our families and friends, MADD's goal is to increase the number of victims and survivors we serve and to continually improve the quality of those services. Our success is measured in the number of lives saved. And though there is no way to calculate the exact number of drunk driving crashes that have been prevented because of our programs, drunk driving fatalities have declined, which means that, together, we have saved thousands of lives since the launch of the campaign to eliminate drunk driving. Altogether, we've saved almost 300,000 lives, and the number continues to grow. But there still are far too many people killed in drunk driving crashes each year. In fact, 1 in 3 people in this country will be involved in a drunk driving crash in their lifetime. One of the reasons MADD is effective is our capacity to create change. Our ability to achieve our mission is only as good as our people and our partners. MADD works in all 50 states, Puerto Rico, and Guam. We have over 1,400 victim advocates in 48 states that serve victims and survivors of drunk and drugged driving. In addition to trained staff, we have 20 volunteer helpline advocates that take calls from victims and survivors 24/7. Thankfully, people of all ages support MADD's work to save lives. In 1 year, people sent over 36,000 emails to their legislators about drunk driving or underage drinking issues. MADD also has a number of wonderful corporate sponsors who help support our programs. For example, the American Medical Association and National PTA support our program, Power of Parents, It's Your Influence, that MADD developed to help educate parents about how to keep their children alcohol-free. We've also partnered with the National Football League to collaborate on players and employee programs, game day initiatives, community relations, and awareness programs to promote MADD's life-saving mission. MADD is proud to work with the National Highway Traffic Safety Administration on the Drive Sober or Get Pulled Over campaign to catch drunk drivers and discourage others from driving drunk. We have positive and long-standing relationships with the government, law enforcement, the judiciary, and others committed to the safety of our communities. MADD measures its success by the number of victims and survivors that take advantage of our services, whether connected with a victim advocate at the local level or receiving emotional support and guidance through our national support line. In a single year, we serve more than 60,000 victims and survivors, serving one victim every 9 minutes. To increase that number even further, we plan to reach out to diverse and underserved populations. To achieve these goals, we will continue to spread the word about the availability of our no-cost services, continue to train new volunteers to work with victims and survivors, and continue to increase our capacity to help others through the generous support of the community. For those 21 and over, MADD is not against drinking, just driving drunk. For those under 21, MADD isn't just against underage drunk driving, but underage drinking itself. Few people know about MADD's victim services, despite the fact that we serve more people each year than almost any other victim services organization. One of the big misconceptions we face is that people think you have to be a mother to be involved or support MADD. The truth is, drunk driving affects the entire family, so we are here for everyone. Since our founding, we helped to cut drunk driving deaths in half, saving almost 300,000 lives. We helped to pass the national 21 minimum drinking age. We've served more than 300,000 victims and survivors of drunk driving. We helped pass the national zero tolerance legislation for underage drinking drivers. And we helped pass the national .08 blood alcohol content standard. We face strong opposition from elements of the alcohol industry. Each year they spend millions of dollars to lobby against our efforts and cast doubt on our motives. We guard against this by making sure that everything we support for both policies and programs are based on the most credible science and are proven to save lives. The uncertain economy has hit MADD especially hard because we've traditionally enjoyed support from automakers and from millions of average Americans, both of whom were hit harder than those organizations who have wealthy benefactors or strong marketing programs. We've worked to diversify our revenue sources over the past few years to help ensure MADD's future in any economy. MADD would add to our victim services, training more victim advocates and getting more volunteers on our 24/7 victim helpline, especially those advocates who can help people who speak English as a second language. We used to have a bilingual helpline counselor, but had to cut that position when our grant was discontinued. We would love to hire this position back. We would equip more volunteers with the ability to create policy change. We used to hold public policy institutes, training over 100 volunteers at a time to effectively lobby for change. We have been able to continue trainings online during these lean times, but would love to be able to have face-to-face trainings that help people learn to create the type of legislative change for which MADD is known. We would expand the focus of our Power of Parents program from just high school to reaching the parents of college, middle, and elementary students. We are in the areas we want to be currently. It is a matter of expanding our existing proven programs and efforts. These include the campaign to eliminate drunk driving, Drive Sober or Get Pulled Over, the Power of Parents, It's Your Influence, Victim and Survivor Services, and our 24/7 helpline. The benefit of filling these gaps is more lives saved and more victims and survivors receiving the support they deserve.